You phase it out?
Sure.
You get rid of it completely?
No, farthest from the truth. I couldn't disagree with you more. But let me first say, there are lots of Republican bills on health care. There are dozens of bills. Mr. Camp has a bill. Mr. Price has a bill.
Budget, so yours obviously is very important.
Actually, that's not the Republican budget. I introduced my own long-term entitlement plan.
Let's hear about it.
And I'll just tell you what it does for Medicare, because that's what you asked me. What I say is, we realize that Medicare has a $38 trillion unfunded liability. That's today. If we wait till 2014, it's a $52 trillion unfunded liability. It's quickly going bankrupt. Medicare goes bankrupt by 2017. And so what my bill does, which has been scored by the actuaries at Medicare as achieving full solvency, which has been scored by the Congressional Budget Office as achieving permanent solvency to the Medicare program, is I say this: if you're in or near retirement, if you're over the age of 55, we're not going to change a thing for you in Medicare. You're going to get the Medicare that you have organized your life around.
You're grandfathering the people.
We're not saying, so let me just finish, if I might, Madam Chairman. We're not saying we're going to cut Medicare by $532 billion, what this bill does. We're not saying, like the actuary is telling us, we're going to have 1 out of 5 Medicare providers go out of business or drop their patients. We're saying we want you to have the Medicare you have right now. And then if you're under 55, if you're like me in the X generation, it's not going to be there for us. We already know the program's going bankrupt in 7 years. So I say, let's reform Medicare to make it sustainable. And the kind of reform I propose is to have the kind of health care that we as members of Congress have. What I get as a member of Congress is I get a payment, and then I get a book
Mr. Ryan, let's
from the federal government.
And so
that's what I'm saying.
No, what I really
No, I know. You want me to explain to you what my Medicare reform is, right?
May I please just ask?
I'm sorry. I was just explaining. I was answering your question. You are asking me what my Medicare reform does.
The question that I want to know, and that I really started with, is your aim is to phase out Medicare.
No, that's not true, and that's why I'm trying to answer your question.
Did you not say that if you were below 55 now, that Medicare would not be there?
That's right. Medicare is going bankrupt. Medicare's running out of money.
Well,
it's a $38 trillion unfunded liability. So let me explain to you what I propose.
I mean,
Madam Chair, are you going to get? Can I answer your question?
Of course. Okay. I hope you will.
So what I'm proposing is for people under the age of 55, we transform the Medicare system to a system that works like what we have in Congress. We get a payment.
Vouchers?
We get a payment just like we have in Congress. And what we get with that payment, you can call it a voucher, whatever you want, we get to pick among a list of pre-certified Medicare plans, just like we do in Congress, to pick our benefit. But I do 3 things to that payment. If you're low income, we're going to cover all of your out-of-pocket costs. If you're sick, and if your health condition deteriorates, you're going to get more money to make sure you can get affordable care. And if you're wealthy, because you're wealthy, you can afford more of it, so I means test the benefit. What that does is it gives everybody who goes into Medicare, people younger than 55, when they turn 65, it gives them the kind of a benefit just like we have in Congress, with additional support for the sick and additional support for low-income people. Doing it that way, by giving competition, by having plans compete against each other for our business, according to the actuaries at Medicare, according to the Congressional Budget Office, makes the program permanently solvent. Medicare still continues. It is still an entitlement. It is still a Medicare system for all, for everybody over the age of 65, but it is done in a way that is sustainable. It is done in a way that actually pays off our nation's debt.
Well, as I understand it, and what you're telling me...
I can tell you don't understand it accurately.
Hold on a minute here. What you're saying is that in the future, the elderly will be given a voucher. The elderly, the mentally ill, the critically ill, all these people that are covered now by Medicare will be given a voucher to go to the public market. Is that
No, I'm saying they'll be given a payment, and they'll have a list of pre-certified Medicare plans.
A voucher?
Medicare, just like it does for you and I.
They go buy their own insurance if they can find it?
Medicare-approved insurance.
I see. Well, I think that
I know you don't like the plan.
Cruelty,
That's fine. Madam Chair, I understand you don't like the plan, but I would ask you then, what's your plan?
I'll tell you
what is your plan to fix this?
We've got our plan.
This isn't a Medicare plan. This actually hurts Medicare.
One of the major differences as well that I want to discuss with you is that this plan that we are proposing to vote on tomorrow covers 95% of all Americans.
You're talking about the under 65 population.
You are going to cover, I think, was it 3 million more people? We plan to cover, I think, about 32 million. You're going to do 3 million.
You're talking about a different bill. You're not talking about my bill.
I believe we are.
No, you're not. You're talking about a different bill.
Well, then let me ask.
You're talking about, I have a bill that gets toward universal coverage. There are lots of different Republican bills.
Mr. Becerra, I think you wanted to comment.
Madam Chair, I hope we get back to talking about the bill that will be passed for the American public. But I think it's important to recognize that Mr. Ryan's plan is out there. It is in legislative language. What we do find is that he will eliminate Medicare as we know it for anyone who is 55 or younger. They will, as you said, maybe Paul doesn't want to call it a voucher, but it will essentially be a ticket that loses value every year because it doesn't keep up with the cost of medical inflation. That seniors who are hoping that in retirement they can afford to have insurance, health insurance, will find it more and more difficult to do. But more than that, what I think we should examine more closely, those of us who are not yet receiving Medicare, is the fact that this Republican proposal by Mr. Ryan raises taxes on 90% of Americans to try to help pay for the cost of his proposal. That's because he will tax employee benefits that currently people who have their insurance through their employer receive. And so what we have fought so vigorously to avoid is a tax on every single American who works today and receives his or her insurance through his employer. Mr. Ryan's proposal would tax, and tax heavily. And so there are ways that he pays for his plan, and we should examine those. There are ways that he changes the program.
Tell us what they are.
Well, as I said, to find a way to pay for the plan, Mr. Ryan will tax each and every American. 180 million Americans today receive their coverage through their employer. They will face a tax under Mr. Ryan's plan.
In your opinion, his plan does away with Medicare and leaves people with a voucher to go out and try to find their own
Medicare as we know it.
Correct?
Madam
Medicare
Chairman,
as we
can
know
I
it
comment on that?
is removed.
Yes, you may.
Look, it's very easy to find savings by essentially, instead of guaranteeing everybody coverage like we do today under Medicare, give them a voucher, and the difference between what is the cost of Medicare and the value of the voucher, all you have to do, you can make it lower, and you save more, but you undermine health care for all people who are seniors. The basic premise of Medicare is that every senior is guaranteed health care. Mr. Ryan's proposal does not guarantee it doesn't. It doesn't.
Okay, I've got to...
Purely,
Madam Chair, obviously we disagree on that. Obviously we disagree on that, and I realize you want to talk about somebody else's bill than your own legislation. That's abundantly clear to me right now.
We're glad to talk about ours.
Let me say two things. First off, I find it interesting that you're saying we're growing the increase slower than health care expenses. That's exactly what you're doing in this legislation. One, you have two things that you claim bends the cost curve in this bill. And you just put this in the reconciliation bill, which is your subsidy for Americans in the exchange slows down in the out years to try and get savings. So you yourself are basically saying we want to do the same thing. You want to slow down. We want to slow down the subsidies at a lower rate than health inflation. You do that as well. Number two, taxing health insurance benefits. You're taxing health insurance benefits in this bill, but unlike my plan, you're taxing them to go to a creation of another government program. I'm saying to Americans, we're going to take this tax benefit and de-link it from your job and give it to you. So that tax money doesn't go to the government for a new program like you're doing. The tax money says, look, if you got laid off, if you work for yourself, you're going to get the same kind of tax benefit that everybody gets when they work for a job. We are discriminating against people who do not have health insurance from their jobs. And so I'm saying, instead of having a tax benefit tied to your job, let's attach it to individuals. So it's not a tax increase. It's an exchange of a tax benefit of one for the other. I know you want to talk about other people's bill than this legislation. I'm only simply saying you've endorsed those two concepts in this legislation alone. And so let's try and all be consistent if we could.
I think Mr. Andrews wants to address that.